Hello there, my name is Laminjai and this is News Review. So today we will take a different approach. There wouldn't be anything that is politics. We will be discussing maternal mortality. This is an issue that has in recent days and weeks made headlines. The fact that women are dying at pregnancy or while at childbirth has become an issue. We have seen at least 2 marches or protests, if you like, calling for an end to this very vexed problem. I'll be joined by officials of the Ministry of Health, but also officials of an organization that is working on initiatives aimed at addressing the problem of maternal mortality in the country. Stay tuned and I hope you'll watch. But before this, we'll quickly look at what the papers are saying. I have the Standard newspaper and the Point newspapers. We'll begin with the Standard, and they are reporting that Badibu mediate Serahule caste dispute. UDP, GFA, that's Gambia for All, lambast Amat over tribal comments. UNDP advises against divisive politics as it signs support to electoral process. Dr. Mbow says Jammeh's HIV treatment worked. Mai says his comments on Hamad's tribal sentiments were taken out of context. So according to the Standard newspaper today, a delegation of imams, Al-Kalulu and community leaders from Badibu on Monday visited Garawal, a big settlement in Kantora, to mediate in a bitter caste dispute among some 53 Serahule communities. Traditionally, the people of Badibu and Serahules have strong relations that allow them to throw jabs at each other without raising hostilities. The delegation hoped to use that age-old mutual respect to broker peace among the feuding Serahule communities over who is a noble or a slave. The delegation under the Opa Badibu Development Association went to Garawal to diffuse a tension that resulted in some 42 caste-related court cases between people from the same community. UDP, GFA, lambast Ahmad over tribal comments. Gambia for All Party and United Democratic Party have condemned Tourism Minister Hamad Bah's much criticized tribal comments. Minister Bah made the comment during a political gathering at the State House on Saturday, where he warned Gambians against voting for the rats. Also, UNDP advises against divisive politics as it signs support to electoral process. The UNDP resident representative has called on Gambians to shun issues that tend to promote divisive politics and embrace peaceful processes based on commonality. Aissata Day said ideals that are common to the Gambia are aspirations for peace, stability and harmony, urging each and every Gambian to work to safeguard these epitomes. Dr. Mbow says Jammeh's HIV treatment worked. Former director of ex-President Jammeh's Alternative Treatment Program, Dr. Tamsir Mbow, has claimed before the TRRC the much criticized program was true and has successfully cured many HIV patients in the country. Mai says his comments on Ahmad's tribal sentiments were taken out of context. The Gambia Moral Congress leader, Mai Ahmad Fati, has said his comments on Tourism Minister Ahmad Bah's tribal statements were blown out of proportion. Minister Bah's Drimo or rat characterization of political opponents attracted widespread condemnation across the political spectrum. The comments were described as inappropriate. Mr. Bah has since apologized, but defending his highlighting of the plight of Fullers with regard to the ID card problem. However, my party differs with many people when it comes to the intent and interpretation in relation to the person of Ahmad Bah. Let's see what's on the Point newspaper there. Dr. Mbow insists Jammeh's cured or eliminated HIV/AIDS. I think that's reported there by the Standard. Sami yet to receive government cooking oil relief package. COVID-19, Gambia registers 4 new recoveries. So let's see what their stories are saying in detail. So according to the Point, the people of Same district in Central River region north of the Gambia have claimed that they are yet to receive their cooking oil as government food package, or I think they meant to say food relief package, 3 months after the distribution of the food items ended. The Gambia has registered 4 new coronavirus recoveries that were discharged. This is according to the 175th National Situation Report since the confirmation of the first case of coronavirus disease, COVID-19, in the Gambia on March 16th this year. Pretty much that is what we can bring you from the papers. We will take a short break and we'll be right back. Welcome back. So today we would be taking a break from politics. We would be talking about maternal mortality and how one group or organization is, if you like, is making profound moves in addressing the issue. There's been a lot of talk in recent weeks around maternal mortality in the country. The problem is blamed on many things, from lack of proper healthcare delivery to the behavior of doctors, etc. So Join Hands to Save a Baby is an organization that is now trying to find a solution. I will be speaking to their officials. Their secretary, Abdullah Jaju, is with me here in the studio. I have Mariama Balajo, a midwife. I have Ami Jaju, an official of the organization there. I have Ami Bella Silla. I also have Ami Juf. I also have Modun Jai, that's the Director of Health Promotion at the Ministry of Health. So gentlemen and ladies, thank you for joining me in this discussion there on maternal mortality and what Save Hands to, or Join Hands there, sorry, to Save a Baby is doing to ending this problem. I will begin with the Director of Health Promotion, Mr. Modun Jai. Mr. Jai, good afternoon. Mr. Jai, can you hear me?
Afternoon, Lamin.
Thank you for agreeing to take part in this. Yes, I can hear you very well.
Lamin.
So I was just saying thank you for agreeing to take part in this discussion there. Maternal mortality, this has been a problem that has been persisting in this country for a very long time. As an official, of the Ministry, I think our speeches are overlapping, but just take your time. I'm sure you'll get my question. So what I was saying is, it's been a long time since we have had the issue of maternal mortality. This is a problem that has been around for a long time, and we have seen fresh, campaigns aimed at addressing or solving this problem, the problem of women dying while pregnant or while giving birth. As an official of the Ministry of Health, can you tell us what efforts are being put in place by the government to ensuring that this problem is fixed?
Thank you very much, Lamin. And I'm happy to be part of the discussion organized by Joint Hands to Save a Baby in collaboration with your other network. I think and it is very important for the public to know what the ministry is doing with regards to addressing issues around maternal mortality. Maternal mortality, there are several factors responsible for maternal mortality. And then key among them, for example, we look at anemia, for example. We also look at, for example, to be attended to. And then so many factors. So I want to emphasize the fact that the ministry currently and before have been working on a strategy to improve maternal, child, and newborn health. And I think you must be aware of the fact that now that with regards to even with COVID, the ministry is still extending intervention to address maternal, newborn, and child health. And then one of the strategies put in place by the ministry, for example, at the community level, is the training or building the capacities of community birth companions. So that these community birth companions at the level, they used to be called village traditional birth attendants. Now that the nomenclature have changed, community birth companions, their role is purely to promote health at community level and to encourage mothers to deliver in a health facility. In a short, we are trying to promote institutional delivery. That is also another way addressing the needs at the community level and also addressing mean, around them attending or attempt to um, uh, attend deliveries that are beyond their scope. That's why their role have been changed, and then they've been given a new designation. The designation is to far and also to guide these women who are supposed to deliver in health. They also encourage mothers to take up antenatal services on time as early as less than 3 months of pregnancy. It's something that they have also been and also they've also been educating mothers, caregivers, and heads of household for them to help pregnant women to be eating a variety of foods that will be able to help them to improve their health. So that is at the level. Going to the facility level, we know that the ministry is working very hard to produce midwives from training institutions. These are the School of Nursing and Midwifery, the School of Nursing in Bansang, that's the SCN School, and the School of Community Health Nurses in Mansakonko. These training institutions all produce trained staff, starting from the general level up to midwifery. There's also another way to increase the human resource capacity at all levels. And these capacities have been distributed in such a way that it will address the demands of the various like we also make sure at least in the age of the family, there is a trained midwife. And this midwife will be there to be able to address some complications that women will. Away from that also, the ministry is also working very hard to get most of the, in fact, all the district hospitals operational. And then the typical example is the TEL that has been operational now, and then several services are taking place there, and then that cesarean section is taking place in SL. And I know if anybody who have known SL, then those services were not provided, they have not been provided for a while. But now that after massive renovation of the facility, with the request of the Honorable Minister for the UNFPA, renovation have taken place, and now the required staff, gynecology, and other specialized staff are also been posted. Gynecology specialized staff have been posted to the facility at SL, and they work very closely in collaboration with the other team members on the ground to address certain complications the next level of
So, Director
the ministry is also working
let me ask you this, ask you this before I bring in others.
Operationalize the district hospital of Brikama, Basse, Soma. Yes, sorry.
Yes, I just want to ask you, what is the leading cause of death of women in pregnancy or while at childbirth? What causes their death the most in the Gambia?
No, as I told you, it is associated with several factors. One of the factors will be delays in seeking care or seeking service on time, and the other factor will be associated with anemia. So, and then there are other, I think I mentioned about the issue of delay. Delay could be linked to either perhaps the inability, maybe. No, that's what I'm saying. Are you getting my point?
Mentioned several factors. You said several factors, but in your data, in your statistics, which one comes first as the leading cause?
I mean, as of now, it will be difficult to determine the leading cause of maternal mortality. It can only be determined by a population survey. And I think the DHS indicated the maternal mortality ratio, and I think up to 430, and has also indicated factors associated with maternal mortality. I just gave you a range, and at this point in time, I will, if I want to go into details, like for example, when I link it, one can link, for example, anemia. Let me just give an example of anemia. If somebody who is anemic and you are pregnant and you're about to deliver and you have a low level, and then that particular person need maybe transfusion, and the person who escorted this particular individual, if they are asked to donate blood to that individual, you can see that the person who escorted this particular person normally they are older age, and then they will normally tell you, because I'm talking from experience, they will tell you to individual. Some of them
Mr.
will
Njai,
tell you,
I'll get back to you in a
I'm
moment.
not very.
I just want to bring in
Yeah.
the midwife in our midst here, Madam Mariama Balajo. She's someone that, on a daily basis, interacts with pregnant women. Madam Balajo, thank you for taking part in this discussion. Thank you. So I just want you to give us your opinion, your assessment really, in terms of the problems that women that are pregnant or while giving birth face. I mean, these are people that you interact with on a daily basis. What do you see in terms of maternal mortality, in your opinion?
Thank you, Mr. Njai. As the director rightly mentioned, the causes of maternal mortalities are high. So then it used to be bleeding, hypertensive disorders, then we have, obstructed labors. But recently we can see that, though as he rightly mentioned, the data cannot be said right now, but we see many women that comes in with hypertensive disorders. So when we say maternal mortalities, we have the delays, as he said, we have the anemia. So like for a woman who is anemic during pregnancy, comes into labor, started bleeding, so definitely would need a transfusion. So when he talks about delays, it's like you didn't come to the maternity ward early, despite having that low hemoglobin level, then you come in bleeding, escorted by an old woman, who cannot even donate you. Then you come into a minor health center, then you have to be referred to a major hospital, let's say. So all these are delays before they will get back to your husband. So these are usually the few causes of maternal mortality. We have the anemias in pregnancy, bleeding while giving birth, and then the hypertensive disorders, obstructed labors, and we have other factors like from the delays, the community level, the attitude of the healthcare worker, and even materials that one needs and it's not available. So these are the few causes of maternal mortality.
These are the few causes there. Thank you. So now I want to bring in officials of Join Hands to Save a Baby. There we have Amijaju, we have at least 3 armies. It's a squad of armies really. So I want to bring in Amijaju, who is an official of Join Hands to Save a Baby, regarding their role in all of this, what they really want to do in terms of joining hands with the government. That is why the Director of Health Promotion is here, to really see what they want to come in and work with the government as a way of ensuring that maternal mortality is a thing of the past in the Gambia. Ami Jaju, we have a number of Amis, but I'll start with Ami Jaju. Ami, can you hear me?
Yes, I can hear you, Lamin.
Okay, so tell us, how did you arrive at this decision or conclusion to partner the government on maternal mortality?
So, called Hashtag Baby. As we all know, we specialize maternity unit. this charity was this 2013, and period everywhere across the country. We had a chance to work with schools. Through that, we've met mothers and baby doctors, midwives, within the health sector. Through that journey of conversation, research, trying to we can tap in, identify the issues, and implement measures on the issue. Is that? That's it. Okay, so are we ready to go?
Yes, can you take that back again? It looks like it was breaking. Can you take that back again?
Yeah, so it was through normally with our charity we do a concert for once a year where we go around maternity and just do our work, which is the charity work. And that we did a lot of research and also via one-to-one conversations with health professionals, be the ladies who had been through childbirth and also friends, through conversations, and most of the issues that, or one of the issues that keep coming out is blood problems, blood supply issues, things like that. So, this actually initiative of blood sensitization, blood donation campaign was started since 2013. And that's the purpose why I brought Ami here. I discussed in 2013 we're going to a blood donation campaign, sensitize people and encourage people to donate blood. And that's because it was around that time that was also an accident of someone dying, and then he's a very, very supportive person to our child, join hands to save a baby. And through a conversation, we came to that of wanting to do a campaign, as she also had a confidence around that got dropped because there are other projects that were very suspended in 2009. Finally, in 2020, we just saw the initiative and came up with a better idea. Yes, initially we was going to do a sensitization and encourage people to donate blood, but then it kind of collective information, so collective ideas. Then I sat down and brought some, and then for yes, sensitization is important. Also, we need to implement measures that would bring change and also help all these deaths that are happening. So we would bring the sensitization that was initially was in place, but then we thought if we build maternal blood bank stations across the country, probably that would help our sensitization or the more productive, and then we the entire everyone to come in and contribute. So the plan is we will implement this maternal blood bank across the regions of the country, and then we intend to be able to ensure that all the equipments that are needed, that we try and put them together. That would include solar system, clinical refrigerator, and all other PPE that are required to set up a proper, station, blood bank station, so that it can be, it can be, run smoothly by professionals who are looking for us to join hands with them in order to improve the facilities, to help them, to empower them to save lives that, we all trying to, you know. So that's that. Yeah.
Thank you. So let me bring in Abdullah Jaju. That's the secretary of your group there. Mr. Jaju, thank you. So I just want to ask you, because Ami was talking about the fact that you intended, as part of your project, you wanted to embark on a sensitization effort, which is very much still one of your plans, but also the issue of you coming up with this grand project of a blood bank installed in all the major hospitals. Can you take us through, I mean, since you are on the ground, your projects and what exactly you want to do?
Right, thank you very much, Mr. Njai. It's a pleasure to be part of the discussion. I am the secretary of Join Hands to Save a Baby, and the foundation is set up to assist or help maternal units across the country. But at this point, right now, what Join Hands is up to is to launch the maternal blood bank for the country. Because recently, we've actually seen a rise in maternal deaths, and it actually calls for alert. And rightly mentioned, there were protests, right, trying to kind of pressure the government or the ministry to do something in order to address the issue. This is very important. So this is why Join Hands to Save a Baby came in order to support, to complement the efforts of the Ministry of Health, right, to at least bring down, if not to eradicate the complete issue. So this is the reason why through our founder, we have decided to come up with maternal blood bank for the country.
How do you intend to go about that? Because you said something, I know, I mean, I think that was the Minister of Health. Do you realize they have said that maternal mortality, in fact, is not going on the increase, it's not on the rise, rather
right. Yeah,
it is falling.
Yeah.
But in this your blood bank, how do you intend to achieve that?
Well, actually, like you rightly mentioned, sensitization is very, very important. It is people that donate blood, right? So it is very important to sensitize people so that people can come in and donate blood that will be in these blood banks. And the launching will actually be done initially at Banjul, but then it is expected to be extended to the other regions of the country, that is from Region 1 to Region 6. Yeah, so we actually calling on volunteers, right? We actually sensitizing, calling volunteers to come and donate blood to be saved in these maternal blood banks.
Let me quickly bring in Ami Diouf. Let's hear what Ami Diouf has to say. Are you there, Madam Diouf? Coming up with programs or projects, if you like, sensitization being one of them, but also to, come up with a blood bank initiative where people would be asked to come and donate blood, and this blood would be kept at a facility, a solar-powered, if you like, facility. That is exactly what Join Hands to Save a Baby is trying to do. So this initiative from the level of the government, how far can this go in helping the government tackle this problem?
Lamin, can I come in? Yeah, I think you are just saying, I don't know whether I missed the point, but I think you are trying to emphasize what yes.
What I'm saying is that you have seen officials of Join Hands saying that they intend to come in to support your government through your ministry, of course, to ending this problem, but they want to do this by way of programs, projects, if you like, sensitization being one of them, but also a blood bank. The issue of coming up with a blood bank where enough blood would be kept. That way, women that need blood at childbirth would be able to get blood in the speediest of ways. So I was asking, how far can this go? This initiative, how far can it go in helping your ministry or your government fix this problem?
Yeah, I think the simple answer is the ministry is really open for partnership and collaboration. And then we're happy that Join Hands Save Baby want to work and partner with the Minister of Health in trying to raise awareness and also so that blood banks are available and functioning. That is a very good idea and a very good strategy, and I think it's not to be endorsed by the minister. But in most cases, like partnership of this nature, normally there is an MOU, memorandum of understanding between the parties, like Join Hands the Baby, Join Hands Every Baby, and as well as the Minister of Health. So that in that memorandum of understanding, the Join Hands and the will now indicate what they can be able to and what they can provide to the partnership. And what do they also want the Minister of Health to do? That's one. These are the documents that will guide our operation. Because I think yes, we want to welcome them, but we also want to do this in the way that at least each and everyone will have that understanding that we can work together for the two parties.
Okay, thank you. Let me
clarify. The Minister of Health National Blood Transfusion Services, and this blood transfusion services have a policy and have a strategy, and it's also good if they work closely with the National Service, which is under the National Public Laboratories. In addition, also, I also admit that there is a need for them to work with the office called the RCH, call it child health, but it's maternal, newborn, and child health. This particular component, there should be a tripartite partner between the National Public Laboratory, the reproductive and child health, Join Hands Baby. In this way, the Health Promotion Director also will have to ensure that whatever, then they are the ones who raise our demand. In demand is also encouraging voluntary blood donation. And you know that when you want to donate blood, there are a lot of issues around blood in general in current communities. You encourage people to you find it very difficult to convince them. So that is why communication component will be inbuilt into this. So for me, I think the ministry will be in the partnership to ensure that at least we all towards promoting and also health of women and children in this country. I just want to emphasize on this.
Mr. Director, so let me try to see if I can get back to Ami Diouf there. Madam Ami Diouf, can you hear me now? Madam Ami Diouf? Okay, let's see if Madam Amibella is with us now. Madam Amibella Silla, can you hear me?
Hi, hello, Lamin. I can hear you.
Okay, I just quickly want you to share with us your thoughts, really. This is a problem that, it's still here, it's still around, very much alive, and now we've seen fresh conversations around it. What do you make of this issue and the fact that you now have joined hands trying to come in to chip in to support the government in offsetting this problem?
Okay, thank you very much, Lamin. Thank you, Partner Network, for having us today on this very important conversation. The maternal mortality is a public health issue, and it's been going on for a while now in the Gambia. Especially recently, we have lost so many young lives which didn't happen, and most of the time it's due to negligence, poor leadership, a lack of facility and resources, delay access to healthcare, poverty, because a lot of time we see a lot of people die from the rural area because of poverty and not being able to access the healthcare at an early stage. And also staff attitude is a big problem that a lot of people have been complaining about. For example, malpractice and just maintenance. So this is a huge concern to all of us. That is why Gambians said enough is enough. We have to stand in solidarity with the victim, and everybody have to come together as as a community to fight against this issue, because a lot of this issue are preventable, and we want the Ministry of Health to step up and help to ensure that there is enough resources, there is enough facility, the infrastructure is very poor, and to help those organizations who want to complement their efforts. And that is why John David, came out, with this brilliant initiative to complement the effort of the government, but at the same time to ensure that this unnecessary death stops. I was listening to Mr. Johnny, who mentioned that a lot of time is due to hemorrhage, which is blood loss, anemia, for example, and other related conditions like malaria, heart disease, a lot of complications. So, coming up with this initiative that Amita has initiated, I think will take us a long way. It will help us to eliminate, if we cannot, stop it completely, but we can reduce the maternal mortality rate in the Gambia. So, if you ask me what my thoughts are, I think we all have to come together, and collaboration is very, very important. We have seen a lot of organizations when they are taking this, but if we can all come together, put our hands together, I think it would be very, very good. This is a brilliant initiative that I think, every Gambian should donate blood if you can, donate time or in cash as well. So that's what I've got to say at the moment.
So the launching. Because people sometimes want to do, but they have, some people have fear of needles, some people have fear of, there are lots of things that people that can cause people be reluctant to donate blood. But they just say, just help, because 1 pint of blood, say 3, and the never know. So, we're just asking the public, not just the banks, but also we want to be able to every pregnant woman in the Ghana collaborate with the health ministry to ensure their blood groups are being checked for their due date, so that we can get these women ready for when the day back to work, that we know their blood group prior to the date, the due date, can the blood available just if they use it emergency. Or we work with the communities to ensure people lined up prior to dates, so that we have people who just come in and don't, if the blood is needed, to get someone to get tested, then and go back and find someone, and then all of that is a that can cause a lot of complications. If you're unable to get time, then that person's life is at risk. So these are looking into just ensuring that the risk assessed for the date that are required to be implemented for their duty in place, and we cannot do that. We have to collaborate with the health Ministry of Health, because they need our support. Need so the government cannot do it all. We're saying to citizens, let's just put our hands together, just to make this keep going on for a while. We've lost so many systems, and as a what can we do, in order to try and minimize all these deaths? And this is the way forward. And open to collaboration.
I'll bring in the Mr. Jaju there to Mr. Blajaju. That's this, Mr. Jaju. So tell us how it's going to look like on. Ami was talking about so the launching to be held on Saturday, Arch 22, the very first of the launchings that are going to take place. How is it going to look like? What exactly are you looking at?
Well, actually, the launching will commence in the morning, that is from 10 to 2 p.m. And we're expecting certain personalities to be present on the day, and as well as the Ministry of Health, and as well as the team that will actually be in charge of the donation itself. But they will actually have their setup where they are going to conduct the donation of blood. Yeah, so we're actually calling on the general public to actually come and support this initiative. It is actually a chance that we can all take to contribute to the eradication or the reduction of maternal death in the country.
Yeah. Yes. So these people that are going to be in charge of the donation there, the blood donation, these are all health professionals, right?
Yeah, of course. They are health professionals from the Ministry of Health.
These are the people that are going to be in charge of that. Okay. So let me bring in the Mr. Director. Are you with us still? Mr. Director. So let me then now bring Ami right back. Ami Jaju, I just want you to, yes, Mr. Director, thank you. So now Joint Hands is looking at launching their blood initiative on on Saturday, which the Minister of Health, I'm sure, officials would be grazing. So what a message do you have in terms of, because this is an organization, a charity that is spearheading this effort, but what message as a health ministry official, what message do you have in terms of how this process should go?
Yeah. Thank you very much. I think I my previous statement. I'm also whether they extend the invitation of Health, Honorable Ahmed Lamin Samate, or the Permanent Secretary. If not, I think it's important that they are also aware, because I was if I met him there today, would have discussed this, but just to say that to give him some ideas about. But nonetheless, I was thinking like there would have been official the Joint Hands to Save a Baby organization of Health. That's one aspect of it. The only thing I want to see is after the launching, for example, then we need to sit down together. When the ministry obviously will endorse that, and then we come up with a roadmap. And the roadmap will indicate as to what we should be doing in the next either in collaboration and partnership. I think this is also very important. We need to come up with a roadmap. I also want to assure the general public that the health workers, these are the and the doctors, no one will see a patient during labor. They feel it so much that nobody want to hear it. They are doing their best and do what they are fortunate. But if you want to, if I'm in the if those conditions happen, see how sad these health workers are. When somebody die here, nobody wants to see it. They don't want to see it. For it, but this initiative also will also help us to raise awareness at community level, at district level, regional level, and as well as at national level. So there could be protection on women and children. And I think this will also add up to on that the ministry will definitely awareness and as well as blood bank available in the country. So this one also a lot. I think from there I want to also suggest the issue of the we're talking about the folk that could which I mean invitation to I got the invitation letter. I'm sure it must also reach follow up supposed to reach so that they can be able to attend the launching on Saturday. It is fortunate that I may not be able to attend the launching because commitment in the provinces, not the other people, inshallah.
To ask Ami Jaja, I just want to ask you because this would require resources. The fact that this blood needs storing, if you like, proper storage facility, and this storage facilities need to have electricity. I heard you talking about the fact that it's going to be solar powered. So, and this is going to require resources. The resource mobilization part. Can you talk to us about that?
Okay, so our plan, we're going to tap into different types and that could be organizing events. Put a goal for it as well. Allow to have an opportunity to contribute to this project. Obviously, like we say, we everyone, it's all the Ministry of Health. The entire, I mean, we're not anyone else. Every little health, and sometimes, I think, by putting everything aside, focusing on what is right, and what is right now is for those women who are going through maternity unit and lives are saved. And that's what we're working towards. And we cannot achieve this in time without the support of all citizens. We are calling Gambia. We're calling Gambia campaign, and let's help to make save the lives of women, mothers, and babies. These babies are going to be the future leaders of our country. They are going to be the doctors. They're going to be the teachers. They're going to be everything for this country to be taken to the next level. And we need to protect them. They deserve to be part of our society. These women deserve to be children grow. They deserve their kids graduate, in university, and that some of them are gone, and there's nothing anyone can do when we put something together, like put our hands together, to show all these panel dead, because most of them are debts, and we can, if we put everything aside, Gambia first, the red, white, blue, white, green, that is our party. Join hands, that is our party, and that's what we focus on. So let's do it, Gambia.
Say their final comments. Let's start with Ami Bella Silla. Ami, you have any final comments, any final message?
You for bringing up this initiative. And also I want to thank all the guests for accepting the invitation. This shows that people want to come together to make a difference in the life of other people, because when we say blood transfusion, 1 unit of blood can save up to 3 lives. This is a concern to all of us, and is a huge problem that we all know the government cannot do it alone. That is why we are urging everybody to come out and support this initiative, because you never know, it could save your life, it could save your sister's life, it could save your daughter's life, So therefore, this is everybody's responsibility, and we want to tell the Ministry of Health also to help the Gambia. We cannot afford to see young women dying unnecessarily, because all these issues that have been raised can be preventable. Okay, so if people are trying to help the government complement their efforts, I think the Ministry of Health also needs to step up, to ensure that there is enough facilities, especially on the day of the launching. As we know, we're still at the time where it's really difficult. Coronavirus is still with us. So we want them to make sure that there is enough PPE, there is enough equipment, and also I'm advising everybody to make sure that they practice social distancing. They must make sure they wear their masks, their masks, and wash your hands, just stay safe, because obviously Corona is still with us, and the only way we can prevent ourselves is to make sure that we have enough equipment, and everybody is aware, with the social distancing and everything. So on that note, I just want to say thank you to everyone, and just remember, this initiative is going to be an ongoing initiative, a long-term initiative. And there is a lot of work that needs to be put in place to make sure that we are able to reach our goals. Okay, so let's work together, Gambia. Let's save lives. The life you save could be yours. So I want to say thank you to everyone out there, and to all the listeners out there. Thank you so much.
Mariama, to say what final message? You have any?
Okay, before my final words, I definitely have a comment to make.
Of course. Go ahead.
I'm a midwife, but also joining hands to save a baby.
Yes.
So we are in the health aspect, because I did not just come up with this, but I've made consultations with health experts. So we have a blood maternal team project. We have a platform where we have lab technicians, we have midwives, we have doctors, we have health workers across and it's just not centered in Combos. We have it stretched to the provinces. We Farafenye, Basse, SL, and all the like. So on the event day, there will be a blood donation process, and then it will follow the due process. We have our donor screen for HIV and AIDS. We have hepatitis and other diseases before. Definitely we have to look into their health before, cancel them before they do the donation. So as Abdullah rightly mentioned, we have a place at the Arch where we'll conduct the blood donation. So we're actually calling on all people who feel they're healthy and fit to make the donation. And of course your blood group will be checked, and then your hemoglobin level to see that you are definitely fit to make a donation. So we didn't just come up with that, and the director was just asking if the minister is aware. Of course the minister of course have been emailed, and then the blood transfusion department also, we are working with them. We are working with lab technicians, different hospitals. So we have teams also in different hospitals. The Briam, we have a team there in Basse, Farafenye, SL, Brikama, and also at EFSTH we have teams there and they have phone, and we have given out those phone numbers. Whosoever wants to donate can call on those numbers and then come forward. So it's Saturday 24th of this month, and it will be done at the Arch. We are calling on people to come in, and of course not to forget their face masks. COVID is still here with us. So that is the message. Let's just join hands and then do it. The saying goes, the government can't do it alone. So we need to partner up. And then because when we say maternal mortality, it has so many factors. And then some of these deaths are preventable. So when we join hands together, we will definitely prevent these deaths. Thank you.
Thank you, ma'am. Mr. Jaju, you have...
Actually, it is joint hands to save a baby that came up with the initiative, but then it is the Ministry of Health that is going to be experts from the Ministry of Health are the people that will be the technicians. They will be handling everything, though we do not have health experts. So it is the ministry that have health experts. So everything with regards to health will be handled by the Ministry of Health. Yes. Yeah, and we will also have some personalities in attendance. The First Lady of the Republic, the Lord Mayor of Banjul, KMC, and we will also have some guests of honors.
So on the whole, it's a huge event.
Well, actually, it should actually be a huge event, because when you look at the impact, it should actually be a huge event. All right, it is an event of everybody.
Yes.
Yeah.
So okay. So now I'll just allow Ami, and then the director would be the very last person. The VVIPs, you know, are always last. They always speak last. So Ami, Jaju, you have anything to say finally before we wrap up? I'll just give you we have only 2 minutes.
Yes, I'm going to read to the health ministry. Say thank you for welcoming and being supportive. To be honest, they've been so supportive. The person behind is for us. We're here to create a platform empower of health. They're going to be in charge of this maternal blood bank in terms of managing how rating them to monitor maternal banks to show people saying benefit from these projects. Even though we say maternal blood bank, we are not going other citizens who are a desperate need of blood. So women, yes, to be prioritized project, and that's because they are much more vulnerable. However, we stop any citizen who may need blood, and blood there. So we have to make sure we get that commitment. Even though we say maternal blood bank for the women, but we do our best in an emergency situation. What a citizen needs outside of that community of and access this service. So we're just urging everyone to support this initiative. It's for the nation, not joint hands. Yes, joint hands, that's fine. But the purpose is to empower the ministry. Like I said, we can create sensitization, talk about it, but until we act, this carry on like the last 5 days. So let's do it. Let's do it. Okay.
Do you have any final word?
Yeah, thank you very much. I'm just happy that the organization is working closely with the National Blood Transfusion Services. It is going to be very, very helpful. And then let them just assure that those partnerships will continue. I also want to appeal to the family members, parents, and then heads of households to adequately support pregnant women to prepare for delivery. Because this is also very important. Birth preparedness is very, very important. And they also need to know that each and every household member need to ensure that pregnant women are supported for them to be able to reach to the health facility on time. And let's avoid delays. And we also ensure that we promote early antenatal booking wherever we are. That will also really help us a lot in our intervention. We also need to make sure that women and children are also supported in terms of basic facilities and as well as information that will be helpful for them and their immediate. Once again, I want to thank Join Hand Save a Baby. I know Ami have been struggling very hard to get this forum organized, and I'm sorry to have to apologize for not being able to make to the discussion on Tuesday due to busy schedule. But I'm sure it's really understood the situation. But I just want to say that the ministry will support you and will continue to work with you in ensuring that we have functional blood banks in our various health facilities with particular focus on district hospitals, general hospitals, and then major health centers. And we also work with you to ensure that we raise awareness on the importance of voluntary blood donation. Because it's important that we go and harvest blood in the communities, and these communities also need to be sensitized for them to know the importance of blood donation. And this will also help us so that we can have enough blood in the blood bank, so that when blood is always needed, it's available on time. On that note, this will not be the end of our discussion. We will still continue to discuss, brainstorm on ideas, develop a roadmap, and then so that start implementing the roadmap. I thank you for your kind attention, and I also want to say that we are happy to work with you in ending maternal mortality in this country. I want to also remind the public that COVID-19 is around, it's real, and we also need to adhere to the precautionary measures. Wearing the face mask, hand washing, and also avoid public gatherings. And if we had organized public gatherings, we also need to ensure that we put on face masks and also to observe the precautionary measures whilst we are also commemorating or celebrating or launching this particular initiative. I wish you a fruitful launching. I will not be around physically, but I'll be with you spiritually. Be rest assured. I thank you very much.
That's Modun Jai, Director of Health Promotion, top Minister of Health official there. Thank you for taking part in this discussion. Ami Jaju, Ami Bella Silla, Abdullah Jaju, and Mariama Balajo. Thank you all. Thank you everyone for taking part in this discussion. So today, that will be that for News Review. We will be back next week. Until that time, goodbye.